Good afternoon, everyone. Thank you for finding and visiting today's webinar. Myself, Jineta Suthar, Parul Institute of Nursing. I'm Assistant Professor from Parul University. Our today's topic of webinar is Research Design, a major tool in research method. I would like to focus on today's agenda for the webinar. So today's agenda is to increase the understanding of nursing student and faculties regarding the various research designs, its significance and application in conducting a research. So now we will see the today's speaker. Today's webinar speaker is our Dr. Sashi Kumar sir, who is a professor and the specialty is medical surgical nursing. And currently he is working in a Yannapoya Nursing College, Mangalore. Sir has a total 19 years of experience and sir has pursued BSc Nursing in 2000 from the Tamil Nadu DR Dr. MGR Medical University, MSc in 2005 from the same college, MPhil in 2011 from the Manipal Academy of Higher Education, Manipal, and PhD Nursing in May 2018 from the Savitha Institute of Medical and Technical Science, Chennai, India. Sir has achieved Best Research Award from the Manipal, and Sir has also published several scientific publications in different areas. We welcome you, sir, and we are very glad to have you here. I would like to welcome you from the behalf of the Parul University. Welcome you, sir. Sir, you can start.
Thank you, Ms. Janita. First of all, I like to thank Parul University for giving me the opportunity to present the topic. So I welcome you all. Good afternoon to all. Today we are going to discuss about research designs. Am I audible now, Ms. Janita?
Yes, sir, you are totally audible.
Thank you.
Your screen is totally visible.
So let me introduce the learning objectives of today's topic. Define a research design. Understand the characteristics of good design. Know the common terminology which is used in both quantitative and qualitative studies, and how to choose the most appropriate design, and identify and explain the different categories and subcategories of research design. So what do you mean research? Research, it is a systematic inquiry to find the answers for the question. So that is the research, and also it is helpful to identify the relationship between the facts. So for do good research, we must need a good design. What is a research design? So I remember one course which is given by the Mr. Abraham Lincoln. If you give 6 hours to chop down a tree, I will spend first 4 hours sharpening the axe. True. It is a common in all the field, even in research also. So when you do plan properly, definitely you can achieve, you can get the answer for your question. So the research design is, it is a overall plan, and it is a backbone of the research. It is the supportive of the studies of research. It holds all together, and it gives you the best answer to the research question. It means it is a useful to test the research hypothesis, and it is a blueprint. I mean, it is a roadmap for the researcher where to go, how to go, and how to ensure the validity of the research. So that is the research design. What are the characteristics of the good design? So good design means it must have some kind of characteristics. So it must be appropriate to the research question. Because if it is not suitable, then whole research become a bias. And it should be free from the error, precision, and its power to control all kind of errors or all kind of extraneous variables. And this good research design means it always fulfills some of the conditions such as objectivity, reliability, validity, and generalizability of the findings. Next is the common terminology, what we are using in a research, both quantitative and qualitative. In quantitative, the following terminologies are using commonly, that is inference, reliability, validity, bias, randomization, manipulation, control, and causality. Inference means it is nothing but it is a draw the conclusions from the evidence. Reliability means accuracy of the information. Validity, it is a soundness of the study's evidence. Bias, it is an error. The error may happen from the samples, from the researcher, sometimes from the instrument also. Randomization. The randomization means randomly allocate the subjects into the groups so that as a researcher you can get the generalization of your research. Then manipulation. Manipulation means it is an intervention which is manipulated by the researcher. Then control. Control means the whatever the bias can be happen, whatever the other variables influence on your studies, on independent variable or dependent variable. So this can be controlled. This must be controlled. So that is the meaning of control. Then causality means the relationship between cause and effect. Relationship between independent variable and dependent variable. So these are all the common terminology which is used in a quantitative design. In a qualitative also, there are some kind of common terminologies we are using. There is called a trustworthiness. This trustworthiness means it's nothing but it is a degree of confidence. So which includes credibility, transferability, confirmability, dependability, and authenticity. Credibility means that is a confidence, which whatever the results and interactions you get, that is a true. Transferability means whatever the findings, qualitative findings, it should be transferred into the another settings. Confirmability, which means objectivity, that is no subjectivity by the researcher. Then dependability, which means stability or reliability of the data in a over period of time. The authenticity means assuring the fair and faithful data. Reflexivity means it is a process of reflecting critically on the self. So these are the common terminology using in a qualitative studies. So before go for design, we must aware about what are the threats may happen into the research. So threats to the statistical conclusion validity, threats to the construct validity, threats to the internal and external validity. So in this importance are threats to internal and external validity. So this can be found before plan your research and plan to control so that you can choose a appropriate research design. So the first one, the history. This is one of the threats to the internal validity, which means that any facts or any events may happen between pre-test and post-test. So that will affect the outcomes of the study. That is called a history. Then testing. So testing means like between pre-test and post-test. When you do pre-test, the participants may become familiar about your data, familiar about your what information you are going to collect. So this one will reflect on the post-test also. So here you can avoid by fixing the time, what time is required between the pre-test and the post-test. The next one is the instrumentation. So instrumentation, that is related to the instrument. When the subject, I mean researcher or instrument, that the problem will be more. So this will be happen in a qualitative studies. Then selection. Here selection of the sample. When the group or when the participants are not homogeneous, then this will be the big threat to your study. Next one is the threat to the external value, that is the mortality. So mortality means in between or during your data collection period, some of the participants may drop out from the studies. So you can't compel them to participate in your studies. So that this will give the threat or this will affect your outcome of the research. So how to avoid it? You can add attrition rate along with your sample size calculation. By that, you can avoid this mortality threat. The another one, Hawthorne effect or Rosenthal effect. So when the researcher become awareness of your studies, their behavior may change either into positive or negative. Then about a novelty. So novelty is the another threat. When the researcher want to test the new intervention, so that ultimately affect the outcomes also, is also may both positive or negative. Then settings, where you are doing the data collection, where you are collecting the data. It may be control settings or it may be the natural settings. So this also will be threat to the studies. In case if it is controlled settings like a hospital or laboratory, that these threats can be avoided. In case if it is in a natural setting, then the researcher should be careful to control this threat. Let's move on to the types of research design. Ms. Dinita,
Yes, sir.
slides are visible now?
Yes, sir. Visible.
Thank you. Thank you.
Continue.
So in research design, there are three types: quantitative, qualitative, mixed method. So as you all aware that quantitative, it plays the role in numbers, whereas qualitative, it plays the game in words. So this is the objectivity, there is a subjectivity. So this is the main difference between the quantitative and qualitative. In a quantitative, you are restricting the participants into the numbers to collect the information, whereas in a qualitative, you are allowing the participants to express in their own terminology, and also you can do it in a natural settings. Okay, so this is the difference between the quantitative and qualitative. So when, as a researcher, you want to confirm or you want to test something, you want to test some facts or events, you can choose quantitative design. Or you want to understand something, you want to understand some of the facts, some of the phenomena, then you can choose qualitative study, where either quantitative or qualitative alone, you can't get answer for the research question. So that is not possible, either quantitative alone or qualitative alone. Then you mix both, use both quantitative and qualitative. That is called a mixed method. So when where you are getting the good informations or valuable information, when you do both quantitative as well as a qualitative, then you can choose the mixed method designs. So under the quantitative, there are few types. One is the experimental and non-experimental, where interventions involved in your research, that is called a experimental design. When there is a no intervention, which is known as non-experimental. Under the experimental, mainly there are three types: true experimental, quasi-experimental, pre-experimental. Whereas under non-experimental, descriptive, correlational, cross-sectional, cohort, case control studies. In qualitative, there are few types: phenomenological, ethnographic, grounded theory, action research, case study, and historical. Under the mixed method, triangulation and embedded research. Other than that, a few more types, which is called meta-analysis, secondary data analysis, evaluation research, implementation research, outcome research and survey research. Okay, these are all the few types of the research design. Now, the question will arise on your head. These many designs are available. What to choose for my study? How to choose? So this is the question. So when this question arises, you ask yourself the following questions. Am I testing any intervention? If yes, go to the experimental. If not, go for non-experiment. Then how to control confounding variables? This confounding variables means it's nothing but it is called an extraneous variable. So these variables may not included in your study, but it may affect your results or it may influence on an independent or dependent variable. So how to control those? So for example, age, gender. So this you can't modify, but it may influence. Even though it influence, you have to control. So you should find a way to control this kind of confounding variable. If it is, how? So find out answer for this question before choose the design. Then you think about, is there need of blinding? So blinding means hiding the intervention to the participants. Sometimes the blinding may be for the researcher also. Then what timing needed for the data collection? If it is a longitudinal or short period of time. What kind of comparisons required? I mean, you need a comparison group, or if need, how many groups you require? Then the next question, where should I collect the data? The settings should be the controlled or it may be the natural settings. So find an answer for these questions before choosing the research design. How to choose the quantitative design? When to choose the quantitative design? If it is the causality, I mean, you want to test the relationship between cause and effect, then choose the quantitative. Then control the extraneous variable. The better option is the quantitative. Control threats to the internal and external validity. So ultimately, quantitative design is the most appropriate. Then if you want to test the research hypothesis, whereas in a qualitative, it is not possible. There you can understand the phenomena. You can't test the hypothesis. So if you want to test the hypothesis, the better option is a quantitative design. If probability sampling possible, then better choice is the quantitative. If probability sampling is possible, randomization possible, then you can generalize the results. Then if generalization possible, then quantitative design is the best choice. So these are the ways, these are all the key features are available to choose the quantitative designs. Next, when to choose the qualitative design? In case, as a researcher, if you want to understand the holistic view of the particular phenomena, the particular issues, then better choose the qualitative design. If there is no possibility of probability sampling because of the very less number of samples available, so the non-probability sampling technique only possible, that qualitative design is better. The data collection can be done in a natural settings. Then you want to study about the individualistic phenomena. I mean, in-depth study of the individualistic or in-depth study of particular phenomenon only, then better choice is the qualitative design. Next, now one more confusion. Now both is there, quantitative and qualitative. Can I do both? So that's the question. Yeah, it is possible. When you feel, as a researcher, when you feel that there is a need of both to get the validity of the information. So you can choose the mixed method. So by doing this, you can assure that there is a validity of the results. So if it is, you can choose a mixed method design. So that's it. Next, we are moving into the designs, the experimental design. So in the name itself states you that it is involved experiment, I mean treatment. So when researcher want to test the treatment, when researcher want to test the relationship between the cause and effect, the choice is the experimental design. So there are three characteristics of experimental design. It is called MCR: manipulation, control, randomization. Manipulation means treatment. Control means control the extraneous variables by a comparison group. That randomization, that is a randomly allocation of the subjects into different groups. So when these all three characteristics are met, then your choice will be true experimental design. So when it's possible to meet all these three characteristics of experimental design, you can choose a true experimental. There are three types of experimental design. One is a true experimental, another one is the quasi-experimental, third one is the pre-experimental. So among these three, most advantageous one, there is a true experimental design because all three characteristics are involved. So the results can be generalized. So that is why I'm saying you that this is the most advantageous design. That is a true experimental design. Let us discuss about types of true experimental design. The first one, basic design. So basic is otherwise called before and after design or pre-test post-test control group design. Okay, so randomly allocated into the two groups. So where interventions involved, that group is called a experimental group. Where there is a no intervention, that group is called a control group. So the subjects randomly allocated into experimental and control group. Pre-test will be done, intervention for the experimental group, then post-test will be done for the both the group. Okay, so it is called a non-equivalent pre-test post-test control group design. When you are not randomly allocated, okay, it is called a non-equivalent control group pre-test post-test design. So the R, I mean randomization is most important in a true experimental design. So this is called a basic true experimental design. Here I given you the example, effects of positioning on back pain after coronary angiography. Okay, so before position, the back pain level was assessed, that is a pre-test. Then after give the position, the pain level was assessed, that is a post-test. So interventions are position, then pre-test and post, I mean dependent variables are back pain. So here, this is the most advantageous one because why I am saying it is advantageous is the most convenient method. Okay, with the availability of samples, you can do this true experimental design and randomization is there. So generalization is a possible. But one disadvantage is because here the one of the threads will be involved, that is a history and testing. Okay, because by pre-test, the participants may aware about what you are going to collect, isn't it? So to avoid these disadvantages, you can go for the another design if possible, that is a Solomon 4-group design. So here involved 4 groups, that is 2 experimental group, 2 control group. One experimental group with a pre-test, another one is the without pre-test. Same like in control group also. So meanwhile, these threads may not much affect the outcome of the studies when you have the two different kind of experimental and the control group. So this is the advantages one compared with the basic true experimental design. Next one is the factorial design. When researchers want to manipulate two or more variables simultaneously, then the better choice is factorial design because it permits the testing of multiple hypotheses in a single experiment. The example is given. They tested some kind of stimulation. There is a auditing stimulation and tactile stimulation. So there are two interventions involved. And here these interventions are interacted with a time limit also. So this timing divided into three, that is a 15 minutes, 30 minutes and 45 minutes. Now this one more advantages is here interactions of the other variables with the independent variables also can be tested in the factorial design. Okay, so it is not only evaluate the main effect, also to see the interaction effects. In this factorial design, one more specific type is available. That is called randomized block design, RBD. It is called a randomized block design, where you want to control the confounding variables. So researcher can make the cells depending upon the confounding variable. Suppose you found the age is the confounding variable. So according to age wise, you create a cells, you randomly allocate the subjects into the each cells. So now you are blocking that variables into the different groups. That is why it is called a randomly blocked design. This is one of the types of the factorial design. So here the examples are given for factorial design. The influence of abuse situation and respondent background characteristics on Korean nurses' perception of child sexual abuse. When researchers want to test the multiple conditions for the same group, that is called a repeated measures design. Okay, so repeatedly the interventions will be tested on the same groups. That is why it is called a repeated measures design, or it is called a crossover design. Okay, so these advantages means when you want to test the different kind of treatment on the same group, that is the main advantages. A randomization is possible because you can randomly allocate the groups, randomly allocate the treatment also. But disadvantages, there is a carryover effect. Because one after completion of one treatment, that effect will be influenced on the another treatment also. This is one of the major disadvantages in the repeated or crossover design. Next, this is a very much important. It is a randomized clinical trial, or it is called a randomized controlled trial. It is a RCT. In a medical profession, experimental design means that is only a randomized clinical trial or controlled trial, or shortly it is called a clinical trial. Okay, in medicine, this clinical trial has been used since 1945. But however, until recently, it has not been used in nursing much. Here, the randomization has to follow rigidly. And it is a beneficial also, but financially, it is one of the disadvantages, especially in our profession. Okay, so the way how to do it, that is from the population, the subjects are randomly assigned into the treatment group and non-treatment group. So outcomes will be measured. Okay, so this is the randomized clinical trial. I mean manipulation, control, and randomization. These characteristics has to be followed rigidly in the RCT. So that's all about was experimental design. Okay, so we discussed about the characteristics of the experimental design in the beginning. There is a manipulation, control, randomization. Now, among these three characteristics, in case we can't follow all these three characteristics, then same like experimental design, I mean resemble like experimental, that design you can choose, that is called quasi experimental design. So one characteristic, that is a manipulation, I mean treatment involved here. Whereas the another two characteristics, that is a control or a randomization. Any one of characteristics can be met in the quasi, either control or randomization. So with this, you can choose the quasi experimental design. This also same like experimental design. It is helpful to test the relationship between cause and effect. And the main disadvantages, there is a chances of subject contamination. It means the informations can be passed from one group to the another group. Imagine that the informations are transferred from experimental to control group. So what will happen? It will be reflect on the outcome of the study. So that is a one disadvantages, one important disadvantages in a quasi-experimental design. So let us discuss about types of quasi-experimental design. Non-equivalent control group design. Okay, this is the first type. This is the same like what we discussed in two experimental design. First type, basic two experimental design. Same like this only. The only thing is a randomization is missing there in a quasi. If randomization is available, it is called a basic true experimental design or pre-test post-test control group design. In case randomization not done, but have control group, it is called a quasi-experimental, that is a non-equivalent control group pre-test post-test design. Why it is called non-equivalent? Because we are not using a randomization procedure. So that means the groups are not homogeneous, not equivalent. That is why it is called a non-equivalent control group pre-test post-test design. If you go through our nursing journals, most of the studies have followed this design only. That is a quasi-experimental non-equivalent control group pre-test post-test design. Here both advantages and disadvantages are there. Yes. Advantages is the most convenient and pre-test post-test is possible. You can compare, you can identify the relationship between cause and effect. But disadvantages, history, maturation, testing, settings. So this is a threats. There is a more chances to affect the results of the study. The another type, which is called a non-equivalent control group post-test only design. So this comes under the pre-experimental also. But here, since we are using control group, so it may comes under the quasi. What is the need without pre-test? See, sometime the pre-test may not be possible or may not be useful. So that time, for that study, these designs will be most appropriate. For example, after giving the intramuscular injection, you want to assess the pain among infants after giving injection. Now, before giving injection, there will be no pain at all. So pre-test is not possible. But after injection, there will be the pain. So after intervention, so only post-test is possible for that. So for that kind of research, non-equivalent control group post-test only design is appropriate. So here one examples are given for a non-equivalent control group pre-test post-test design. Effect of support groups on caregiver of patients with schizophrenia. So the support groups therapy, I mean like a psychological therapy which is prepared by the researcher is given for the caregivers. So before therapy, what was their level of adaptation, that is a pre-test, and after that how the level of adaptation to the care of patient with schizophrenia, so that is a post-test. So that is a one example of the quasi-experimental. And another types of quasi-experimental is called a time series design. So it means the data collections maybe happen over an extended period, and you can introduce the treatment during the data collection period. So you see the first type, O1, O2, O3, O4, intervention, O5, O6, O7, O8. That means 4 times the variables are assessed, 1 time interventions given, again 4 times variables are assessed. So repeatedly information was collected from the samples. This is called a time series design. There are plenty of types are available under time series design. I will discuss a few. The second type is a time series non-equivalent control group design. Okay, we can have the control group, same like a first type only, but here the control group, I mean comparison group also can be taken. Third type, time series with the intensified treatment. Okay, so which means gradually the new interventions will be introduced along with the old intervention. Okay, so that is a time series with the intensified. So informations will be collected repeatedly. See, O1, O2, that's a 2 times informations collected, interventions given, then O3, O4. Next one, along with that intervention, one more intervention added. Then 5th time and 6th time data are collected. Then along with the intervention, second intervention added with that. Then 7th and 8th. Here, not only the new intervention, even the time intervals also can be changed. So first time intervention may be for 15 minutes, second time may be for the 30 minutes, third time may be for the 45 minutes. So like this also you can do the study that is called time series with the intensified treatment. Next one, time series with withdrawn and reinstituted treatment. This also possible in a time series design. 2 times assessed, O1, O2, giving intervention. Then third time and 4th time assessment will be done. Then no treatment with a short period of time gap. 5th time and 6th time for collecting the data. Again, you are reintroducing the same intervention. Then 7th and 8th time observation. This is called a time series with withdrawn and reinstituted treatment. This is example, one example I given here. That is an interrupted time series design. So interrupted means few times observation, then treatment, then no treatment, observation, then with the treatment, observation. This is called the interrupted time series design. Here one examples are given here. The steps of simplified toy child exercise program on the physical health of older adults who is living in long-term care facility. There are 3 pre-tests have done after allocation of the samples. In a 1 month, 4 post-tests at a 1 month, 2nd month, 3rd month, and 6th month. Each observations have done, I mean post-test done after the intervention. Okay, the 50, the step was implemented 3 times a week, not a continuously. One is a 50 minutes per session for the 6 months, but 3 times a week. So it is called interrupted in an intervention. So that is why it is called the interrupted time series design. This is another types of the time series design, which is called a counterbalanced design. Which means each group exposed to the all the treatment So when researcher want to test the 4 kind of treatment, so subjects will be allocated into the 4 groups. After each intervention, observations will be done. All groups will undergo all the treatment. It is like a crossover design, but this can be done as a quasi-experimental also. Counterbalanced design. If you split the same thing into the nest, then that is called a nested design. What we discussed there, no, randomized blocked design. Same like here, you can prepare the nest. The same, the multiple interventions you can test. It is called a nested design. That's it about quasi-experimental design. Next, we move to the third types of experimental design. That is a pre-experimental. Here, among 3 characteristics, there is MCR, manipulation, control, randomization. In that, the other 2, it is not required. That is a control and randomization may not required. Only manipulation, if it is available, I mean it is possible, then pre-experimental design is the better choice. The 2 types, one group pre-test post-test design, another one group post-test only design. Compare with the other experimental design, this pre-experimental is the most disadvantageous one. Advantages means it is the most convenient and easy to understand by all, easy to do the research. And when the sample size is very less. See, this was happened during this corona period. Some of the researchers planned for a quasi-experimental, but there is no patient in the hospital, but they, because of lack of sample size, they have changed it into the pre-experimental. Okay, so like this, when there is a very less number of samples, you can go for pre-experimental design. And when there is a pre-test not possible, you can do the one group post-test only design. Here some examples are given. So that's all about experimental design. Next one is the non-experimental design, which is involved no treatment. The researcher want to observe the variables or observe the phenomena only without manipulating. That is a non-experimental research. There are few types. The first one is the descriptive design. So it gives exact picture of a situation, what it happened naturally. And this information can be obtained from the large number of samples also, is the most advantageous one. And some studies contain 2 variables or more than that also can be assessed in a single point of time. And the disadvantages, here the whatever the information you are collecting from the particular group, it may be the superficial also. For example, by standing in the mall, you are asking about what kind of soap you are using, what kind of shampoo you are preferring. You can't assure that whatever information they are giving, it's all true. Sometimes you may get a superficial information. So that is one of the disadvantages in a descriptive design. Second types of non-experimental, it is a correlational design. So in the name itself, you can identify correlation. That is a relationship can be identified between 2 or more variables among a single group. But disadvantages, you can't identify the relationship between cause and effect. So that is possible only in the experimental design. Example of correlational designs is correlation between age and knowledge. Here, in the result, the 3 types of correlational results you may get. One is a positive correlation, negative correlation, no correlation. Then under positive and negative also there are different types. Okay, but mainly there are 3 types of correlation. You may get positive, negative, and no correlation. Other than that, the non-experimental design, that is a cross-sectional design. When researcher want to do the in-depth or want to collect the in-depth information, So the cross-sectional study is feasible when the researcher want to determine the prevalence. So cross-sectional is most appropriate. And another type is called a cohort study. So here the researcher will focus on particular group only to collect the information. It may be about the incidence, causes, and prognosis of the disease. Then one more type, that is a case control study. So case control, the case control, that means by comparing between two groups can identify the information or identify the particular phenomena. That is a case control. So comparison of the outcomes from the two identified groups, that is a possible in a case control study. So that's all about experimental study. In experimental study, we have discussed about true experimental, quasi-experimental, non-experimental. Okay. The next is the qualitative study. When researcher want to do in-depth information about the phenomena. So qualitative study can be useful. So under that, few types: phenomenological, ethnography, grounded theory, action research, case study, historic. Phenomenological means so nothing but it is studying about the phenomena, to understand about the phenomena. For example, want to study about lived experience of the patient before entering to the operation theater for major surgery. So that is a lived experience, or the lived experience of woman with a ischemic heart disease. So this is a phenomenological study. Then second one is the ethnographic. So ethnographic, it is a study about the culture, study about the intact cultural group in their own settings. I mean, in the natural settings. That is a ethnographic. There are two kind of approach possible in ethnography. One is the emic approach. Another one is the etic approach. Emic, etic. Emic approach means the researcher will be participated along with the group and they will observe the culture. That is the emic approach. Etic approach means they may not involve with the group, they will be away from the group and observe the culture. That is the etic approach. I remember I studied one article about this ethnographical study. The researcher wants to study about the tribes in America. That researcher gone there, settled there, and he got married from that particular group. He lived for 2 or 3 years. After that, he started the study. I mean, he started to study about the their culture. So this is called a emic approach. So there are two approaches possible in ethnographic studies. The next one is the grounded theory. So this means studying about the particular environment or particular phenomena. After that, the researcher can construct the theory based on what information got from the samples. The researcher can construct the theory that is called a grounded theory. One example, I'll say that the experience of mothers of pediatric surgery children. Okay, so after study about their experience, the researcher constructed the theory. So this is an example of grounded theory. The another one is the case study. So case study, you can understand the meaning. It is an in-depth study of single program, or it may be study about the single event, about the single group, or it may be activity or among a single, individual also. That is a case study. The recent study, I'll give you an example. Studying about the reactions of the teachers and students to an online education. I mean, internet-based class. So now it has become a common. So these studies are done as a case study. The next one is the action research. Action research means nothing but the researcher and participants collaboratively act in the research to find the answers for the question or to find the fact. That is called the action research. This is one of the qualitative study. The another one is a historical study. So history, about the history. I mean, study about the past events. That is called a historical study. These are all called qualitative study. So when you want to study in depth or when you want to collect in-depth information, the better choice is a qualitative study. In a nursing profession, nowadays the maximum of our students or researchers concentrating on qualitative and mixed method study. So previously it was not like that. So that's it about qualitative study. Next one is the mixed method design. So when researcher decided that quantitative or qualitative alone not possible or not feasible to collect the in-depth information, or maybe results may not be valid, then you can mix both the approach, quantitative and qualitative. That is called a mixed method design. There are mainly two types. One is a triangulation, another one is the embedded research. This embedded research means it is a multi-method research. You can use the multi-methods to collect the information. Like for example, you can use the instrument, printed instrument. You can go for the focus group interview, single interview, or Delphi survey. So like this, the different ways of different methods you can use to collect the information. That is called the embedded mixed method design. Another one is the triangulation. Okay, this triangulation is called, there are multiple methods. I mean, qualitative and quantitative can be mixed. This is a triangulation. But the researcher says that there are different types of triangulation is possible. Okay, so triangulation means what? We are mixing, that is use of multiple references so that you can draw the good results or you can draw the good information about the truth of phenomena. So it is helpful to bring the multiple information by using multiple data sources. That is called a data triangulation. When you are using multiple data sources, that is called a data triangulation. Next one is the time triangulation. The researcher may use a multiple time to collect the information about the same phenomena. That is a time triangulation. Next one is the space triangulation, which means the researcher can use the multiple settings to collect the information about the particular phenomena. That is called a space triangulation. When you use a multiple settings. Then person triangulation, which is called the different person can collect the information from the subjects. That is a person triangulation. The another one is a method triangulation. This method triangulations only mostly in our profession we are using, that is a multiple methods, quantitative and qualitative. So that is called a methods triangulation. So that's it about the mixed method design. Okay, that's all about types of research design. So mainly quantitative, qualitative, and mixed method. Now few tips I am giving you to designing the research. So before choose, make a written list of the pros and cons of each. Balance a number of consideration like a time, cost, ethical issues, and integrity of the study. So these are the main points. So before choose design, You just have discussed yourself or with your group about this and anticipate alternative finding. I told you that due to this corona situation, there is a less number of samples, so the other designs changed. So like that, you should anticipate it. If it is not possible, then what is the other alternatives? Then consider whether the design adjustment might affect the results or not. Then seek the advice of research experts before deciding any design. Then write out a rationale for your design, whatever you choose. So this is the major tips to choose the design. That's it. Any doubts? Please ask.
Yes, sir. So it seems like everybody understood well about today's topic. Okay. So thank you very much, sir, for your wonderful session and giving us the time and having. We are really glad to have you. And we have, I think, covered a very broad topic in 1 hour. And I would like to thank our principal, sir, Dr. Ravindra, sir, and I would like to thank him for giving me this opportunity. And so I think everybody understood well about today's topic, and we'll see in the future also if we can do a new researches nowadays. Thank you very much, sir. Yes.
Thank you.
Thank you, sir. Thank you all of you for visiting our page. Thank you very much. Thank you, sir.